We're all surprised to learn that Robin Williams was in the early stages of Parkinson's disease when he took his life earlier this week. The actor also said to be battling depression and in the past addiction. As it turns out, both of these conditions, depression and Parkinson's, are often found together. Let's talk about all of this with Dr. John Sullivan. He is a neuropsychiatrist for Brigham and Women's Hospital. Doctor, thank you so much for joining us.
My pleasure. Thanks for having me.
So when we hear Parkinson's, we think Michael J. Fox, we think Muhammad Ali.
Right.
But I guess it would be helpful to know what the link is between depression and Parkinson's, now that we hear that he was apparently diagnosed with this.
Sure. Well, when you see someone in the news or a celebrity with Parkinson's disease, the obvious things are the movements that they have that are slow, or they may have tremors, things like that. The people who live with someone with Parkinson's are aware that there are other sides to it. There are cognitive issues and there are mood issues, and depression is very common. It's
common once the Parkinson's is setting in.
It's more common as the Parkinson's progresses, but it also can precede the Parkinson's even by several years.
Interesting. And then, so you're saying that depression, not that it can lead to Parkinson's, let me just make sure I get this straight, but depression may be one of the early signs of Parkinson's?
Right. I mean, I would emphasize that depression is quite common. Parkinson's is relatively uncommon. So most people with depression don't have Parkinson's and will not develop Parkinson's.
Okay.
But of people who do have Parkinson's, more of them had depression beforehand than people who don't have Parkinson's.
No, yes, you said that perfectly. Okay. So that's very fascinating. Now, I was reading all about it last night, you know, because when you just want to know more information, you can't, there's not a specific test that you can take and then a doctor can say you have Parkinson's disease. So you just go based on symptoms, correct?
That's correct. It's what we call a clinical diagnosis. So it's based on a detailed neurologic physical examination, and also by taking a careful history of the symptoms and the time course, etc.
So what are some of the symptoms we should be aware of?
For Parkinson's disease?
Yes.
The early symptoms that are characteristic would be tremor, usually of one hand or the other, sometimes the legs or other body parts, difficulty with gait or balance, unsteadiness, and slowness of movement. Sometimes also people will develop what we call a masked facial expression, which certainly you see later on, but also sometimes fairly early in Parkinson's.
So those are some of the symptoms. What's the treatment?
The treatment for Parkinson's disease primarily is supplementation with a medicine called levodopa, which supplies or provides the precursor to dopamine in the brain, which is the chemical in the brain that's depleted in Parkinson's disease. There are a number of other medications that also support the function of dopamine. There are also surgical treatments that have become increasingly used and effective in recent years.
So does any of that medication help with depression as well? Because you're talking about dopamine, and I'm just sort of assuming. I'm no doctor, you are, so.
The medication for Parkinson's, in fact, often does help with depression. We do use traditional antidepressants in addition sometimes, but you're on to the fact that the link between depression and Parkinson's disease is often because of the loss of dopamine itself, which is a chemical in the brain that is associated with mood and movement and many other functions. So
you're out there, you're listening to this, and what do you need to know if you think this could be you?
Well, first I would say to anyone who feels that they have or has a loved one who may have depression, certainly that's something that should be discussed with a physician and evaluated. And for anyone with Parkinson's disease or a family member, it's important that they pay attention to signs of a possible depression emerging and talk about that with their neurologist or primary care doctor to see if a referral to a psychiatrist or neuropsychiatrist would be helpful. Excellent information. Dr. John Sullivan, neuropsychiatrist for Brigham and Women's Hospital. I enjoyed talking with you. Thank you so much for the information. Mike, to you. Very